The NHS's strategic plan notes that management of long-term conditions is now a central task of the NHS, caring for patients for the longer term rather than in single episodes of care. Personalised integrated care has an important role to play in reducing the demands placed on health and care services, and in the Midlands they've placed improving the support to people living with these conditions high on the agenda. Dudley Clinical Commissioning Group is working to create a new model of care in the form of a multi-specialty community provider. Sue Saville has more.
Come on in. Hiya, Jeremy.
Hi, Jo.
Putting the patient at the heart of integrated medical and social services is the new model of care in Dudley, coordinating a range of professionals to deliver efficient care in the community.
Brilliant. You've lost a pound.
Health coach Joe is working with newly diagnosed diabetes patient Jerry to reform his lifestyle.
I work quite closely with the GPs that are associated with diabetes clinic and with blood pressure clinics, and they will send me and refer those patients, and in which the GP feels this is a patient which lifestyle change will really make an impact on.
Making changes is what the NHS itself must do if it's to solve the challenges of an increasing and ageing population.
What we've done in Dudley is to bring all our different staff from different organisations together into integrated care teams, and we use the concept of team without walls. Population need is changing, and that requires a change in the way the NHS works to be able to work better together because our patients are presenting with multiple complex needs.
Here in the Dudley Borough, 1 in 5 people has been diagnosed with a long-term condition, needing support from a range of services. The Dudley Clinical Commissioning Group secured funding of £10.7 million over 3 years to be a vanguard, delivering new models of care as a multi-speciality community provider, or MCP.
The MCP model has been developed into a standard framework for use across the country. GP Steve Mann says central to their success so far is the multidisciplinary team.
The team will involve both doctors, nurses, community nurses, mental health workers, the voluntary sector. It helps us to coordinate care for patients in a much more effective fashion when you have all the caregivers in one room. And our aim is to offer a more holistic experience of patients actually based in the community with multiple skill sets available to patients in our community locally.
I'd like to discuss an 84-year-old gentleman who has been brought to my attention by one of my colleagues.
All the relevant services plan the patient's care together.
I work for the Integrated Plus service, so we're based in the voluntary sector and we provide non-medical support to health practitioners. So, for example, people who are socially isolated, we can refer them to lunch clubs and things like that.
I get a real value from here because you get to interact with different services and speak to people directly.
The meetings are invaluable to our service because on a weekly basis, any patients that we've got any problems with, we can liaise direct, get problems sorted out.
If I've got any concerns about patients that I've been to visit, I can feed back and then discuss it openly with other health professionals and get the right referral for the right patient and the right help at the right time.
It's quite magical, really, you know, and you think, well, everybody knows something about this patient and it all comes together at the meeting.
By asking the patient what matters to them, both in terms of their health needs, their social needs or their psychological needs, we can really get to the bottom of how we can support them in the community.
In his own home, Jerry is putting into practice the advice of his health coach.
It's been a sea change being introduced to Jo, who's been fantastic. She's a lifestyle coach. She's educated me significantly. It's up to me to make that difference and not blame it on somebody else or make it a responsibility of the NHS.
Tailoring care for those with long-term conditions will help prevent complications, easing pressure on acute services so the NHS too can be fit for the future.